Hello, everyone, and welcome to today's briefing about the Braidwood Management versus Becerra court case and its potential impacts on employers and on patients' access to important care. We appreciate you being here and know that there is increased interest in today's briefing and the case, given a key appellate ruling last Friday that came as somewhat of a surprise to many of us. My name is Kristen Wakilius, and I serve as the Chief Program Officer at United States of Care. I'll be kicking things off today before handing the ball over to my colleagues, Liz Hagan, the Director of Policy Solutions, Eric Waskowitz, Senior Policy Manager, and Orla Levens, Federal Policy and Government Affairs Coordinator, who will walk through some of the ins and outs of the case and its impacts on people, employers, and the health system more generally. Well, I know that many of us have a number of remaining questions following the ruling last week. We hope this provides a clear overview of what we do know at this point, both for those of you following the case closely and those newly engaging on this. Before we start, I want to cover just a few housekeeping items. All of you tuning into this call are in listen-only mode, but we really encourage you to submit questions for our panelists using the Q&A feature. We've built in time at the end of the webinar to allow our panelists to respond to your questions. So please feel free to add your questions throughout the presentation, and we will try to get through as many questions as we can. There's also the ability to submit a question anonymously if that's your preference. This session is being recorded and will be made available after today's webinar concludes. Closed captioning is also available for the webinar. To turn it on, you can navigate to the meeting controls toolbar at the bottom of your screen and select Show Captions. We'll get started. So for those of you who aren't familiar, United States of Care is a national nonpartisan nonprofit organization dedicated to building a fairer, more affordable, accessible healthcare system. And we ground our work in listening to people, and we work with partners at both the federal and the state levels to push for the policy changes that people tell us that they want for their healthcare. People across the country have told us that the cost of the care that they need is their top concern. So that's why we as an organization have been working with stakeholders, policymakers, and advocates in order to maintain no-cost access to preventive care that we know people need. With the ruling last week, while the ruling last week has a more limited immediate impact than some may have anticipated, the decision highlights the continued long-term threat to preventive care for people across the country. We and many others will continue our work to preserve long-term access to free preventive care for the millions of people who depend on it. So in today's presentation, we'll start by providing a broad overview of what's at stake in this case, not just for the millions of people with private coverage, but for the healthcare system more broadly. We'll provide an overview of preventive services, the regulatory bodies that are involved, the legal history of the case, as well as offer insights into how this case may evolve in the future, including a look at last Friday's court decision. And then we'll discuss how policymakers and regulators have responded, as well as what's next for employers. We'll have about 10 minutes at the end saved up for a quick Q&A. And as I said, we'll try to get through as many questions as we can. So how did we get here? We'll talk in much more detail about the case as we go, but in brief, the Affordable Care Act contains provisions that require insurers to cover recommended preventive services with no out-of-pocket costs. The law's authors recognized how important access to these services, and more importantly, free access to these services, would be to improving health outcomes and lowering costs more generally. We refer to this provision as the Preventive Services Mandate. Regular access to preventive care can often catch illnesses or conditions early or prevent illness entirely, saving both people and the healthcare system money. And the evidence, which we'll cover in more detail later, shows that this approach has been effective, and it's also one of the most popular components of the Affordable Care Act. A court case that originated in Texas, called Braidwood Management versus Becerra, called into question the ability of certain bodies to make recommendations for which services will be covered at no cost. And the initial ruling out of this court would have allowed insurers and employers across the country to impose out-of-pocket costs for some services, or in some cases, drop coverage altogether. This case has been winding its way through the legal system, and just last Friday, the Fifth Circuit Court of Appeals issued a multi-part decision. Now, there are a few immediate important takeaways from this recent decision that we wanted to share, especially for those of you who may be tuning into this case for the first time. First, the circuit court decision released last Friday preserves most people's access to cost-free preventive care in the short run. People who may be understandably confused by all the moving pieces of this case should rest assured that for now, they are still able to seek the needed preventive care services that they have come to rely on. This is great news. Unfortunately, this is not the end of the case, and people's no-cost access to preventive healthcare services is still at risk. While the full impact of the most recent decision remains to be seen, we know this fight is not over. The circuit court allowed for some exceptions for the Braidwood plaintiffs and raised questions about the ability of other employers to raise similar challenges. The decision also means that we may have to wait for some future court decisions in future rulings. If the mandate is overturned in full or part, insurers or employers may be able to reintroduce cost sharing for preventive care services. And we know that facing costs means that people often forgo or put off these services. And it has the potential to reverse more than a decade of progress in improving outcomes, increasing uptake, and lowering costs. We'll talk about this further, but it also creates a patchwork quilt of coverage standards that could vary by state or by employer, with some people maintaining free access while others have to pay for services. And we know that these burdens often fall heaviest on the communities historically underserved by the US healthcare system. US of Care has been working tirelessly as a leading advocate since this case first began in order to ensure that our healthcare system does not go backwards. We've drafted model legislation, helped pass bills in states, provided testimony, and we organized an amicus brief to the Fifth Circuit Court of Appeals with 16 state and national partners. We have and will continue to rally consumer advocates and inform employers and reporters about the stakes of this case. We are so grateful for our partners who have been alongside us and will continue this work for as long as this case is a threat to people's access to the preventive care that they need. For more information, we encourage you to take a look at our Preventive Services Resource Hub, where we house US of Care and partner resources. You can find issue briefs, FAQs, fact sheets, and more. And we will be continuing to update this hub as new resources are developed. And with that, I'll turn it over to my colleague, Orla, who will kick us off.
Thanks, Kristen. As Kristen said, my name is Orla Lovins. I am the Federal Policy and Government Affairs Coordinator here at United States of Care. And before we dive into the ins and outs of the Braidwood case itself, I wanted to step back a bit and talk about how we got here. Next slide, please. So before the Affordable Care Act's passage in 2010, there were very few consumer protections in place to ensure that people had access to needed preventive care for free. As a result, many plans simply didn't cover critical preventive services that many of us have since come to rely on. For example, prior to the ACA, only 2/3 of plans covered some maternal health services. Even if these services were covered, they were rarely done so without cost sharing. Cost sharing, even as low as $1 or $2, can be a huge barrier to care. Preventive services ultimately protect people, providing cost savings for them and the healthcare system long term. We know that our listening work here at US of Care, that affordability is people's top concern with the healthcare system. Polling indicates that at least half the public, as you can see on the screen, has skipped or delayed care, including preventive care, due to cost alone. Next slide, please. People's access to free preventive services have vastly increased since the passage of the ACA. The number of people receiving recommended blood pressure screenings, colorectal cancer screenings, HPV vaccines, and flu vaccines have all increased. These gains have been even more pronounced amongst those already experiencing disparities. This includes low-income, Black, Latino, AAPI, and Indigenous communities who historically have had low utilization rates of preventative care. For example, colonoscopy screening rates have increased at a higher rate amongst Black and Hispanic adults compared to that of white adults. This shows that addressing preventative services access can also be a tool to promote health equity. Next slide, please. Not only are these ACA protections effective cost-wise and at improving outcomes, they're also just very popular amongst the general public. According to the polling, 48% of adults utilize preventive services annually. Nearly 4 in 1 adults say preventive care is still the most important service that insurance plans should cover under the ACA. And something to keep in mind throughout this presentation, half of adults, including those across different party lines, oppose judicial efforts to repeal a mandate requiring insurers to cover preventive services. Next slide, please. So what happens if the preventive services mandate were to be overturned? Well, eliminating the mandate would reintroduce some form of cost sharing, returning us to the same Wild West landscape that existed before the ACA. The evidence is clear that people forego preventive care if they have to pay for it, which leads to increased health disparities, worse health outcomes, and higher costs for people and the system. Polling has shown that in the event of a decision that removes the no-cost mandate, more than 2 in 5 people would not pay for out-of-pocket common and popular preventive services. Even more concerning is that 60%, that's 3 in 5 people, would not pay for tobacco smoking cessation services and unhealthy drug use screenings. And 53%, over half of adults, would not pay out of pocket for depression screenings without the mandate. Restricted access to preventative services and medications could cause an increase in preventable diseases. For example, as many as 2,000 additional HIV infections could occur per year if cost sharing were reintroduced for HIV prevention medication. More than a decade of progress in health outcomes could be reversed if the mandate were to be overturned. Next slide, please. So, who determines what preventive services should be covered for free? Well, under the ACA, 3 government panels assure that experts, instead of the members of Congress, are able to identify the appropriate services to be covered at no cost. First, plans are required to cover COVID-19, influenza, and other vaccines recommended by the Advisory Committee on Immunization Practices, known as ACIP. Plans are also required to cover all services receiving an A or a B recommendation by the United States Preventative Services Task Force, also known as the USPSTF. The USPSTF is an independent group of national experts that makes determinations for general adult preventive services, such as cancer and diabetes screenings, as well as some for children, like obesity and vision screenings. It's important to note that the USPSTF has existed before the ACA and has long been seen as a leading body on preventive services. Finally, plans are required to cover recommendations made by the Health Resources and Services Administration, also known as HRSA. HRSA recommendations are for women's services like breastfeeding supports and contraceptives, and also children's services like newborn screenings and well child visits. So, taken together, the more than 100 services recommended by these 3 services, with a lot of acronyms involved, have formed the basis of the ACA's no-cost preventive services mandate. And over the past decade, this list has remained fluid and is constantly revisited to ensure that it is guided by the latest scientific and medical developments. And with that, I'll pass it over to Eric to talk more about the legal developments surrounding Braidwood.
Thanks, Orla. It's all very helpful and really just setting the stage and really leading us to where we are today. So I want to go ahead and talk about the case itself. This is the latest of several cases over the past decade plus to challenge various aspects of the ACA, many of which you're familiar with, I'm sure folks here on the call. This latest case, Braidwood versus Becerra, has been winding its way through the federal court system since it was first filed in 2020 by Braidwood Management, self-insured business in the state of Texas, and several other individuals in the U.S. District Court for the Northern District of Texas. The plaintiffs, we're talking about Braidwood and others here, argued, among other things, that the ACA's preventive services mandate is unconstitutional because it violates the Appointments Clause. It claims that these 3 agencies that Orla mentioned earlier, the USPSTF, HRSA, and ACIP, making the recommendations for these preventive care services covered cost-free, don't have the constitutional authority to do so. Next slide, please. So despite knowing the potential impacts of millions of people's access to free preventive care, the district court judge with the case ruled partly in favor of Braidwood on September 7th back in 2022. He agreed with the plaintiffs in saying that the ACA's preventive services mandate violated the Constitution's appointment clause, but with a twist. So instead of applying his ruling to all preventive care services under the mandate, he limited it to just USPSTF services, and specifically only those that were recommended or updated since the ACA was passed in March of 2010. So while this decision was smaller in scope than we initially predicted, it still had the potential to devastate people's access to many critical preventive care services such as PrEP, lung cancer screenings, and behavioral health care screenings. It has the effect of failing to take into account medical best practices and scientific advancements since the passage of the ACA, and in discarding really any updates since then. So, for example, USPSTF finalized its updated colonoscopy recommendations in 2021, saying that all adults be screened for colorectal cancer every year beginning at age 45. But because this recommendation went into effect after March 2010, the recommendation actually reverts back to guidance issued way back in 2008. So we're looking at 14 years ago, recommending that screenings begin at 50, not 45. So obviously this doesn't reflect expert medical opinion and really has huge implications for people in their late 40s who actually may no longer have these screenings covered for free. So what does this mean? The district court decision took effect immediately nationwide back in March, at least until the federal government appealed the decision and the Fifth Circuit Court of Appeals issued a stay, essentially a pause in the lower court's decision. It's also worth noting that at the same time, the district court also found that the requirement to offer PrEP, this HIV prevention medication, also violated religious freedom laws, which could restrict access to one of the public health's biggest recent success stories, as Kristen mentioned before. Next slide, please. So that was the district court decision. Now let's fast forward a few months. Several rounds of various legal motions later, amicus briefs submitted, and oral arguments back in March, we finally received a circuit court ruling this past Friday. And in it, the Fifth Circuit panel, made up of 2 Trump-appointed judges, as well as 1 Biden-appointed one, released a unanimous decision and the next step of the Braidwood case. The decision, in the court's own words, was, quote, a mixed bag. So first, the Fifth Circuit agreed with the lower court that the composition of the USPSTF does violate the Appointments Clause of the Constitution. However, and this is a big however, the Fifth Circuit disagreed with the lower court's decision to essentially invalidate the USPSTF preventive services mandate nationwide. And instead, the Fifth Circuit narrowed this decision and decided to apply this to only the plaintiffs in the case. So while this protects access to preventive care services for millions of people nationwide, other employers besides just Braidwood that offer coverage within the Fifth Circuit, so we're looking at the states of Texas, Mississippi, and Louisiana, may seek to limit access to these free preventive care services, potentially affecting thousands or even millions of people within these states and their access to needed preventive care. One thing I'll note in the decision as well that came out last Friday, the Fifth Circuit punted or remanded some outstanding considerations and questions related to ACIP and HRSA back down to the lower courts for additional review. So this means that many vaccines and as well as services for women and children, while safe for now, at least in the short term, may actually ultimately be at risk. Next slide, please. So where does the case go from here? The Fifth Circuit's decision remains in effect for now, but there are a few different legal paths the case could take should any parties decide to appeal, and it's really hard to know where the chips may fall with so many different variables at play here, but we're going to try to figure this out. So what are some of those potential outcomes moving forward? As previously mentioned, the Fifth Circuit remanded part of this case back down to the district court level, meaning that there are still legal questions to sort out regarding access to free preventive care services recommended by ACIP and HRSA. While we don't know how the district court will rule, I think it's safe to say that looking at previous decisions made by the district court judge in question here is not encouraging, and it underscores the risk of people losing access to these services they've taken for granted and expect to have for free. The plaintiffs, Braidwood Management, and others could also seek an en banc review of the case by the entire Fifth Circuit Court of Appeals. This means that the case could be taken up by the Fifth Circuit again, but instead of just a panel of 3 judges, it could be taken up by the entire circuit court to hear the case. And of course, I think one other possibility is that the case may be appealed to the Supreme Court. If this does occur, the Supreme Court decides, and the Supreme Court will decide whether or not to take the case. At this point, it's not really clear that they would. It's still up in the air at this point. There could be other paths forward. I think, we don't want to kind of assume that these are the only paths forward at this time, but I think both the plaintiffs and the government play a big role in the possible outcomes, and we're definitely keeping our eyes open for any moves made by either moving forward. I think one thing that we do know for certain right now is this likely is to be a process that continues for many months, if not years, and really is going to cause a lot of uncertainty for people as they realize or figure out whether or not they'll continue to have free access to these preventive services. So recognizing this, in the meantime, policymakers have stepped up to put in place protections and provide education on both the federal and state levels to ensure people remain able to access these services for free. So to walk us through some of those decisions, I'm going to turn over to my colleague now, Liz Hagan, with some more for everyone.
Thanks so much. You can move forward one more slide, please. Thanks everyone for being here today. I'm Liz Hagan. I'm Director of Policy Solutions at United States of Care, and we'll be talking a little bit about how we are expecting to see state policymakers, federal government, issuers, and employers all react to this latest decision and what we might expect to see sort of moving forward. Next slide, next slide, please. Thank you. So thinking about what this means for state policymakers sort of first, there's a lot of uncertainty at the federal level. And so understandably, states are really interested in pursuing protections to make sure that their residents are able to be protected and able to continue to access free preventive services. And so as you'll see in the slide here, we've seen a number of states pursue legislation and be successful in doing that. 16 states now have state level protections to protect cost-free access to preventive services. In addition, we saw following the decision that Eric outlined in March of 2023, that 49 bills were introduced across 19 states. And so 16 of those were successful thus far. Most of these protections have come in the form of codifying the ACA's no-cost preventive services mandate, and that really is focused on states regulated at the state level, or plans regulated at the state level. So for example, in the individual market, small group market, and state employee health plans. And so it's really important to note that while most employer plans are regulated by the federal government, the state only has jurisdiction under over a certain number of plans. And so their ability to really have a say on some of those is more limited. And so we want to think about some of the federal government response, which I'll be talking about in a second too. We've worked with state advocacy partners on the ground to pursue legislative solutions to protecting preventive services, and we've testified in support of legislation in Michigan, Massachusetts, and Washington to do so. We also have template legislation for states that are looking at pursuing legislation in this space, and we would, of course, be happy to connect to anybody interested in that as well. Next slide, please. Looking to the congressional side of things, congressional action has been more muted, as many offices have waited and are in sort of a more wait and see approach based on what the circuit court ruled in the case. And in April of 2023, congressional Democrats pressed 12 major issuers on whether they plan to continue access for people to have free preventive services, and an overwhelming majority of those said yes. So for now, most of our work has really been focused on educating policymakers on the Hill and their staff about the importance of access. And we're really, I think, in a holding pattern for now as we're all parsing through the decision that came out on Friday. And I think jumping into legislative strategy at this point is a bit premature. So we're still sort of waiting and figuring out kind of next steps and what this would potentially look like, given some of the outstanding questions about the possible outcomes as Eric went over. Next slide, please. So thinking about sort of where we are with the insurance side of the house, as I mentioned, a number of plans issuers have committed to continuing access to preventive services. And this is, I think, also been conveyed by the America's Health Insurance Plans, AHIP, which issued a statement after the district court ruling, also saying that this is important to continue to be covered. And AHIP announced last week a new coalition of public and private sector partners to promote access to no-cost preventive services. So I think we're going to see more and more sort of talk of these things as the case gets a little bit more settled since it came out last Friday. Next slide, please. And moving on to sort of what this means for employers. The circuit court decision in particular has injected a lot of uncertainty into the health insurance landscape, especially for people who live in the Fifth Circuit's jurisdiction. There's risk that employers pursue litigation to drop cost-free coverage for these services. And this would really move us into this patchwork system of preventive services that look very different from state to state. And it would, I think, allow a lot of states to be considering different levels of protection that they want to put in place to ensure that people are continued to be protected. We also know that in April of 2023, the Department of Health and Human Services, Labor, and Treasury released an FAQ related to preventive services that outlined some of the protections in place due to the fact that people are already in plans that have contractual obligations. And so there's certain requirements to make sure that people are notified ahead of any plan, benefit changes. And so those would still hold true. But it is important to think about what this would potentially mean long-term and what sort of openings and paths forward there are for those employers. We also know that we could probably expect to see more information coming from those agencies in the form of maybe a potential FAQ because there's a lot of, as I said, a lot of uncertainty about what this really looks like. Next slide. We do know that, sorry, one more slide, sorry about that. We do know that there's a lot of polling that suggests that there's a lot of support for continuing access to free preventive services. And I think this is really reflective of the fact that people understand the benefits of this. And there's also an understanding from employers that this makes good business sense. Despite this, we don't know what this is ultimately going to look like, as Eric mentioned, and we want to make sure that we continue to lift up the importance of preventive services and an understanding that this is really a long-term, strong investment for employers to make, and that will lead to a lot of confusion for employees who are not quite sure what this means for them. And sorry, one second. My place here. Next slide, please. I'll actually turn it over to Kristen. We're going to move over to some of the next steps moving from the case, but I did just want to underscore, I think, as I mentioned, there's a lot of uncertainty related to the case, a lot of questions remaining. We're going to get to a lot of those questions as we move into the discussion in a bit, but underscoring that there's a lot of possible outcomes and a lot of different kind of paths that this can take. And I'll turn it over to Kristen to talk a little bit more about where we're seeing some of that play out.
Thanks so much, Liz. And as we're nearing the end of the presentation, just want to encourage folks to continue to use the Q&A function to submit any questions that might be coming to mind for you. And we'll move to the next slide. So hearing all of this content makes you all probably think, what can we do? And there are a few things that are important for people to know about. So in the face of this continued threat to preventive services, we're calling on all employers to continue providing and covering no-cost preventive care for their employees. Despite the circuit court's decision that potentially left the door open for employers to pursue litigation to drop cost-free coverage, it's really clear that people have come to depend on this care and otherwise generally wouldn't seek it if there was a cost involved. So employers will play a key role in making sure that we don't walk back the health access, the equity, and the outcome gains that we've seen in the last decade. And now, for those who are not employers themselves, there is a lot that we can do. First, it's important to spread the word about this case. There are so many big court cases in the news, and this one has so many complexities. It's easy to miss. It's important to make sure that the word is out there, and feel free to use our resources from our resource hub to let people know about how this case might impact their access to needed preventive services. It's also important as employees to talk to your HR department or third-party administrator and ask them or make sure they understand how important continued cost-free coverage is. And finally, at the same time, there is still a lot of confusion out there, and it's important to address it. People need to know that for the time being, they should continue to see their doctor for checkup appointments, for screenings, and know that their preventive care will be covered with no cost. As of right now, people have continued cost-free access to these services, and it's important to make sure that people aren't confused about that very important point. Okay. That brings us to the end of our presentation, and we'd love to open it up and take questions that have come in from the audience. We've got a couple that are focused on what states can do and some of the implications for that. So I'll ask our panelists, can we maybe start by speaking more about how states can step in to protect access to these services?
Yeah, I'm happy to kind of take a first bite of the apple here and then turn it over to my colleagues to see if there's anything they'd like to add in addition. So, as was mentioned earlier, and we've been involved in many states now, kind of, submitting testimony and supporting legislation to codify some of the protections on the federal level, on the state level. And this legislation kind of comes in several forms, and I kind of want to walk through some of the components within some of these bills that we've been seeing across the country. And so, obviously, one, kind of adopting the recommendations made by these three task forces on the federal level, looking at USPSTF recommendations, looking at ACIP recommendations, and then also HRSA recommendations, and codifying those protections on the state level. And I think we've seen that being done in a bunch of states, about 15 or 16 across the country. I think many of these pieces of legislation also include a mechanism through which to update services as needed. So, making sure that we don't kind of avoid the situation right now that we see with the USPSTF recommendations that kind of has that date cutoff in March 2010. We want to make sure that, for some reason, there's some sort of mechanisms to kind of make sure those new recommendations are incorporated into state law, say no longer than a year after the recommendation is made on the federal level. And so, through I think those two kind of mechanisms, we see states kind of really taking action to codify these protections. I do know, there are some concerns over ERISA here, and so I think it's important to note that, making sure that these protections are enacted on the state level is not a panacea. We're looking at affecting plans that are offered through the individual market, through the small group market, state employee health plans, things like that, but a lot of employer-sponsored insurance, is regulated at the federal level. And so while state protections certainly are helpful for folks that are insured through plans regulated at the state level, it is not a catch-all and really does not, take into account all covered lives, within the states. And so just important to kind of note that fact. I think, aside from codifying federal protections, that there's also other ways that states can, at least in the interim, kind of make sure that people have access to this coverage. There's certain actors, insurers, employers, otherwise, that potentially from time to time run afoul of the preventive services requirements. And so making sure that, states have the tools needed to identify these non-compliant actors, and making sure that, state departments of insurance, have sufficient resources and the ability to kind of make sure that insurers are living up to those expectations, either under state or federal statute. I think is important. And then making sure that patients are held harmless. We don't want to make sure, have a situation in which, in the interim, people are paying these costs that it would otherwise be covered cost-free for either these preventive services or any ancillary services surrounding them. So, certainly other options out there. I will draw attention to folks that there is a recent NAIC report that was put out last year that kind of talked through some other solutions that states and others can take to maintain access to preventive care. And so I would encourage folks to take a look at that if interested. Anything that folks on my team would want to add to that?
Thanks, Eric. That was really helpful. Got another question asking about contraceptive coverage, and could contraceptive coverage be impacted if HRSA services are struck down in some way?
I can take this one. Yes, HRSA does, or HRSA's recommendations are usually influenced by the Women's Preventive Services Initiative to identify the gaps in recommendations for women. And on that list of their recommendations are contraceptives, not only contraceptives, but contraceptive counseling as well. And that applies to pretty much anything currently listed in the FDA's birth control guide. So, oral contraceptives and contraceptive patch, like all of the likes that are in the FDA birth control guide.
Great. Thanks so much, Orla. Okay, we have a question about the implications of the court case. If an employer is headquartered in the Fifth Circuit and doesn't want to cover all of the USPSTF services for their employees, and they bring that to the court, would that apply only to employees who work in the Fifth Circuit states, or would it apply to all employees nationwide?
Sure. So I can take this, and certainly others jump in on this. So the question is related to sort of the applicability within the Fifth Circuit and what happens to employers within the circuit. One, I think the question of what happens to employees outside of that is sort of, I'll take that in a second. But from our understanding, if an employer is in the Fifth Circuit and they want to stop providing free access to any preventive service or preventive service related to this case, that they would have to seek litigation to do so. And I think the pieces related to outside of the state is the people outside of the Fifth Circuit would not be affected by this. But I think as we've talked about, is that there's a lot of, I think, uncertainty about sort of the scope of how many employers actually want to do that, given the benefits that preventive services provide, both for them as from an employer perspective, understanding that this would raise costs long term, but then also from a competitive perspective, there's not a lot of employees that want to work at a place that doesn't provide robust coverage as part of the benefit package. So I think that piece of the equation is less clear. But the people in the Fifth Circuit, I would say, are the most potentially impacted before we're kind of waiting on the other outcomes of the case more broadly. But want to open it up in case there's anything else others want to add.
I think everything that you said, Liz, was entirely accurate. I would also mention that, like, in the circuit court ruling, the judges did say explicitly that they believe that the lower court's decision to apply the relief of the case universally was wrong, and because it was filed so last minute. So that the court in this most recent decision did course correct that, applying to the whole country. But what Liz said about the Fifth Circuit is, yes.
Thanks, everybody. One question that we got: does this have any impact on the practice of checkups being billed if the patient mentions something outside the parameters of a no-cost checkup? I believe that's an issue that's beyond just the preventive services mandate, so this case has no direct impact on that, but would love for my US of Care colleagues to opine or hop in if there's any more to add there.
Yeah, Kristen, you're right. I think that's the question is, a good one, and I think it's outside of the sort of what's being looked at specifically to this case. But we do know that there are a number of people that get preventive services and then have sort of other things connected to that service that are then billed, and so the preventive services is not free. And there's I think a lot of interest from CMS and SSIO to make this, to improve the situation so this isn't the case, but this is not directly related to sort of what the court is looking at here.
Great. And we have a question beyond the plaintiffs in the original case. How many employers or insurance plans stopped free coverage for certain preventive services?
So my understanding, and not have a hand to the ground in the states, where this court case is moving forward, is, the thinking is that for most states out there, the mandate still holds at this point. And so I think, across the country, for folks that are, say, you're an employer in the state of California or North Dakota or Rhode Island, and you don't want to offer some of these preventive services, you're still, required by law to cover them, whether, you appreciate that or not. And so I think, for most folks in the country, as you mentioned before, that these protections remain in place, and to offer these preventive care services that are outlined by these three agencies, but also cost free. I think that the question now remains for those that, for those employers or insurers that may have a presence in the Fifth Circuit. There are some questions there outside of just the folks that are listed as plaintiffs for the Braidwood case. And I think we'll kind of, see, some of this kind of bubble up potentially in the next few weeks and months as folks try to understand, the implications and how broad this ruling may be, or, and what that looks like in terms of those companies that are based in those states. But as of right now, for a majority of the country, if you most states out there, 47 of 50 states, the preventive services mandate remains in place. And, we certainly want to, make sure that people know that.
Great. Thanks, Eric. We've got a question that is going to require a little bit of prognostication, which is incredibly difficult in this case. But the question is, of all the outcomes, what seems most likely?
I'm happy to kind of take a stab here, and I think I'll preface this by saying that no one on this call here is a lawyer, and so certainly, and I think predicting what the court is looking to kind of do, or any of the parties in the case is sounds like an art more than a science, but it seems to us, based on the recommend or the decision issued by the circuit court, that it appears to be that both parties of the case have more of an incentive to not appeal this further up the chain. I think the thinking is that if you're a plaintiff, there may be more opportunities to advance your cause, whatever they may be, on the district court level. And I think, given the more narrow decision than I think a lot of us expected from the circuit court, there isn't necessarily an interest for the defendants to appeal this further. I would again argue that is just kind of my interpretation of things as of right now, and so certainly an opinion at that point. But I think for folks that think that this may be on a fast track to the Supreme Court, I think I might caution some caution against that thinking based on what the circuit court decision said this past Friday.
Yeah, and just to underscore that, definitely this is a long process that we're looking at, and I think there's also a lot of sort of decisions that will indicate what the next there's a lot of interrelated kind of steps and where this could go from here, and we're going to be continuing to better understand kind of where that might land, but I don't think there's been any indication from either party kind of where they want to go at this point. But if you're thinking about where the different points and opportunities there may be, I don't even think we really know that yet, because it could very well be that they decide to appeal to the entire Fifth Circuit, or that it goes entirely back to the district court. And so a lot of different possible outcomes on that. But I think absolutely right that it would, given where the outcome came on the government side, there would be very little interest in appealing, given the narrow focus.
Well, thanks, Eric and Liz, for that. And I think that prognostication is maybe a great place to end today's conversation. We've tried to make it through as many questions as we could. And if you had one that we didn't get to, please feel free to follow up with us directly. And if, as you read and learn more about the case, additional questions come to mind, we're here, and please reach out to us at any time. I want to thank Orla, Liz, and Eric for joining me in this discussion, and to everybody for your participation and for all of the thoughtful questions. And as we mentioned before, please continue to check out our Preventive Services Resource Hub that's on our website. Reach out to us if you have questions, and please help spread the word about Braidwood and its potential impacts on people's access to care. When you close out of today's webinar, there will be a brief survey that pops up, and we'd really appreciate if you took a moment to give us any feedback you have. And finally, keep an eye out for a follow-up email to this presentation with a recording from today's webinar and the slide deck that we presented today. Thank you again for joining us, and have a great rest of your week.